don't know whether it was coincidence that ma'am invited and this article got published in Times of India recently on 20th of Feb, which says why young Indians in their 20s are developing brittle bone. And just to quote that article, there was a patient, 16-year-old young girl. Only complaint was constant body pain. She visited all kind of doctors in last 4 years. Ortho, gynae, physicians, endocrinologist. Nobody thought of osteoporosis. And finally, one daring doctor did a DEXA scan, and it was a well-classified osteoporosis. Score was minus 2 point, above more than 2.5. So, where are we going? Because we all know that osteoporosis used to come in ladies after menopause or in gents after andropause, after 60s. But now the shift is coming down. And I think, or the literature says, that the two important reason is, one is the sedentary lifestyle. Thanks to the luxury which we have now, everything is available at our doorstep. So sedentary lifestyle first. And second is dietary habit, the junk food habit which we have developed. So these two things are the reason that why we are getting osteoporosis and osteopenia at 20s or 30s of their life. See, as I told by the previous speaker, childhood and adolescents are very important age of the development. And skeletal changes can occur during the, first part is the development is when the baby is in their mother's womb, first 9 months, then 1 and 2 years of age, and second and the most important is at the age of puberty. देखो हम सब ने एक चीज सुनी है, हमारे बड़े बूढ़े क्या कहते थे कि जवानी में खाओ बुढ़ापे तक चलेगा. That was actually the reality. The problem is that we have shifted our target now. See, whenever 11 to 14 years of age in girls, around 14 to 16 years of age in boys, there is a puberty phase, and peak bone mass is around till the age of 20s, and after that we start losing the bone mass. So nearly 50 to 60s we start developing osteopenia or osteoporosis. There is a standard way. So at the age of 20s and around that we develop or we get the what you said bone bank. So we have to work on that. And what contributes to this bone mass or bone bank? Yes, it is right that 60 to 80% is the genetic variation, but after that the diet and a healthy lifestyle contribute remaining 40 to 20%. Just to give you an example, a young girl around 165 centimeter of height can have a lumbar vertebra bone mass of 10 gram, and the same girl, same height, same ethnicity can have a bone mass of 20 gram with the same genetic composition. That is because of their diet, their lifestyle, their exercise pattern, which Dr. Kanika told. So, if we develop a good bone mass, or if we increase the bone mass just by 10%, the chances of development or coming osteoporosis can be reduced to 13 years. So that is a huge point. 10% increase in bone mass can delay the development of osteoporosis to 13 years. So the girl having 10 gram of bone mass of the lumbar spine at that age, likely to get osteoporosis at her 40s. But same girl of 20 gram, either she will not get osteoporosis or she will get at around her 60s. So there is a huge difference because osteoporosis directly hit the chances of having fractures. Fractures is the most leading cause of death. Let it be hip fracture, knee fracture, or the spine fracture. About the diet, Dr. Shweta has told about calcium, protein, and vitamin D. And this, I told in the earlier point also that 11 to 13 or 14 years, the females, the girls, they have the puberty phase, so bone growth phase. And in boys, after the growth also, they continue to get mineral deposition in their pelvis and the spine area. That is why, in general, the build of boys are bigger than the girls. So I want you to just see this slide, or it can be a take-home message, because हमेशा एक सवाल पूछते हैं कि बच्चों को कैल्शियम क्यों देना, बच्चा तो अच्छा खा पी रहे हैं. Well, it is right, बच्चे अच्छा खा पी रहे हैं, but one has to supervise it, कि वो क्या खा रहे हैं, क्या नहीं खा रहे हैं. Either mother or father should be their dietitian, or they should go to dietitian. But going to dietitian is again a commercially driven point. So I think in current world, parents should take the charge, or dada, dadi, nana, nani, whomsoever is there. Because at around 1 to 3 years of age, the calcium required is around 700 mg or 113 gram of protein. As we grow 4 to 8, it becomes 1000 calcium and around 19 to 20 gram of protein. Further 9 to 13, 1300 plus 34 gram. And after that, the protein requirement of boys increases. So in total, either we have to take it by our diet or we have to supplement it. So do not hesitate to discuss about the dietary pattern of the kid, and first try to emphasize on to the parents about modification of their diet. Otherwise, we have magical pills so that we can give them, so that we can at least cope up with the developing phase of the kids. This previous speaker have already spoken about that. Coming to the exercise. Well, exercise is the most essential part. It is WHO have recommended that 1 hour of moderate to vigorous exercise of childs from 5 to 17 years of age is highly recommended. There is no single day break unlike adults, because हमारी एज में होता है 5 days a week 1 hour of exercise, but that is, I am talking about 5 to 17 years of age, and that is the minimum 1 hour. Over and above is good. The only thing is that we should not advocate the kids to go to gym, because weight training is not good for the developing one. Weight training by their own body weight is fine, like push-ups, squats, but any weight which they can take by going to gym, because a lot of influences, we should discourage that. Another concern which the European Council have come up is the amount of sitting time of the kids, sedentary sitting time. So in 2014, it is published that 60% of sitting time is increased of the pubertal age group, irrespective of boy or girl. And this 60% was actually dedicated for their bone health or general health, happy playing time. But because of many development in schools and everything, because parents are busy, the time is gone to the sitting time. Sitting time may be playing by on computer, maybe writing or scribbling or whatever they are doing. But because of this, the bone bank get reduced. हमारी asset कम हो जाती है बच्चों की, नींव कमजोर हो जाती है. And that is the problem that, again back to the first slide, Times of India, we are developing osteopenia or osteoporosis in young age group. In fact, आज के दिन weight gain is very common in puberty. So what happens? We force them to, promote kids or, bug them to reduce weight. And all the weight training exercises which promotes weight reduction is actually harmful. Harmful and more harmful for girls because it affects their sexual hormones also. So weight reduction exercise protocols are most of the time are anti to the bone bank. So we should be very careful when we advise this part also. Last is the few unhealthy habits like tobacco, alcohol, too much of coffee, soft drinks. Again, we should be very judicial when we advocate about that. So osteoporosis kids is a very different topic, so I will not go in detail of that. And thank you everyone.